Well, welcome back to More About Birth. It's another episode with Shannon Bennett, our host, and her co-host, Angie Hansen. And this, I hear, is going to be a very special podcast because you guys are going to talk about your postpartum experiences having children. That's exciting. So I hope you'll join me as we have a front row seat to this conversation.
There is a lot of confusion about the difference between normal baby blues, postpartum depression, postpartum psychosis. And I know I suffered from postpartum depression. Mm-hmm. You've suffered from postpartum psychosis. Mm-hmm. And probably 70 to 85% of all moms have suffered some baby blues. Mm-hmm. So let's get the baby blues out of the way. And then I'll share my story if you'll share yours.
Sounds good.
Okay, baby blues are just that normal hormone shift that we talked about in another podcast. There's a lot going on. Mm-hmm. Immediately after the baby's born, there's this euphoria, and then we have the milk come in, and there's this big old hormone shift, and you're just a bag of hormones for about 24 to 48 hours. And you can feel kind of sad, irritable. I remember when I had my first baby, my husband was working until about 9 o'clock at night at that point. His shift didn't get over till then. And so my mom was there with me, and she would come throughout the day because she lived in town, and then she'd leave a little bit before he got home, just so we could have our privacy. And the minute she'd walk out the door, I would burst out in tears.
Yeah.
It was dark outside. I felt so alone. It was just hormones.
Yeah.
Well, one day she had forgotten her purse, and she stepped back in the door to grab her purse, and she said, "Do you cry every time I leave?" Aww. And I'm like, "Yes."
Yeah.
So that's just normal, like baby blues. You're not getting enough sleep. Mm-hmm. So it's all a new experience. There's a lot of adjustment going on. Sometimes you don't feel like a good mom, or you're just sad.
Yeah.
But life doesn't feel hopeless.
Uh-huh.
So that's normal baby blues. And it's usually, I don't know, I think it's usually gone around 2-3 weeks at the most.
Okay.
Hormones usually level out. But then postpartum depression lasts longer than that, and it's a little bit more intense. So with my last one, and interject here anytime you want or ask me questions because I may not remember all this very well. So with my first one, I kind of had the baby blues, and then that passed quick enough. With my second one, I felt like I had the baby blues, and they lasted a little bit longer. But with my third one, we had moved to Denver, and I didn't have family in town. And my mom did come when my daughter was born. But after she left, I noticed I was still just feeling so sad. And I had this friend that had been suffering with infertility for years, and she just couldn't understand how I could be so sad and so depressed when she'd been trying for years to even get pregnant. Here I had these 3 beautiful children, and I had this, little girl that I had always dreamed of after my 2 boys. And I remember not wanting to get out of bed in the morning. I was like, I just hope I die in my sleep, because if I have to wake up and feel like this again all day, I don't want to do it.
Yeah.
And I would talk to myself and say, how can you even feel this way? You have this perfect baby that's beautiful and healthy and whole. You have a great family. You've got a great husband. You're doing well financially. There's just no reason for this. And so then you start beating yourself up. Why do I feel this way?
Yeah.
It's just awful.
Where's your faith?
Yeah, where's your faith, right? You've prayed about this. Why aren't you healed?
Yeah.
And other people didn't understand, and I don't even know if my husband understood how deep it went. And so it did get a little bit better, but even like 7 months later, I was like, something just isn't right. I still do not feel right. I'm still having these feelings. And so I went in to see the nurse midwife that I had been seeing, and she wrote me a prescription for an antidepressant to take for a while just to level things out. And I see that in my practice. I have a few moms that need to take a low dose of Zoloft just for maybe 2-3 months, just until their hormones level out, and then they're great. But since then, I know you and I have talked about other things that can be done for normal, mild postpartum depression. What would you suggest? Pop quiz, Angie.
Thanks. I was just about to say, well, I'm so much better than I do.
Yeah. I do this to her all the time. It's like,
Yeah.
Pop quiz.
Well, we try to start with the natural. We try to start with environmental things like, what's your situation? You know, do you need more help? Do you need more outside time? Do you need more relaxed time?
sleep?
You need more sleep, of course. You always need more sleep. But what are the like things you can shift and move around to make it better? Then we look at, nutrition. There's herbal support.
Yes, we have a great product.
What's it called?
Blues Busters.
Blues Busters,
I'm like,
thank you.
I had a brain freeze.
Yeah.
It happens often.
Blues Buster herbs is one that we use a lot and start with that.
And it's safe for nursing. It's
Yeah.
also safe for pregnancy
Yeah,
for people who are
it's
having a hard
great one.
time.
And a lot of times that's enough to kind
Yeah,
of bump
yeah.
people out of that. That
Yeah.
one works great.
Or sometimes just getting out of the house. I had a mom call me
Yeah.
at 2 weeks and she said, I'm still just feeling so So I asked her some questions and I found out she'd been in the house
Yeah.
in the winter
Yeah.
for 2 weeks straight. She hadn't gone to the store. She hadn't gone for a ride. I said, have your husband take you through the drive-through and get some dinner and sit
Yeah.
and watch the sunset and eat
Seriously, yeah.
it. Go visit
Just
a
getting
friend.
out in the car.
Yeah.
Yeah.
Yeah. So there are things we can do. Did you try any of those things? Because I know it wasn't offered to me. No one offered maybe a vitamin supplement or an herbal supplement or any of those things. They went straight to medication.
Well, because I had my last two babies with you, I'm sure we did try the Blues Buster. We started with that and, especially.
And you had help. Your mom was there,
Oh, yeah.
right?
Yeah,
You had
yeah.
lots of help.
Yeah, I think, yeah. I mean,
Lots of-
without being waited on and having
Yeah.
a personal assistant, yeah, I have probably, as much or more help than a lot of people.
And lots of skin-to-skin contact.
Yeah, I had
So-
great relationship with my baby. Nursing was going great.
That hormonal
She was
cocktail
healthy.
was doing its thing.
Yeah.
So what happened? And at what point?
Yeah, so,
I remember. I just want you to tell the story.
yeah, so
While
with
I eat your
me, it was later on than I had expected. So there were some things just in my own health and especially in our marriage at the time that were kind of tough, that had just been tough, like through the pregnancy and into postpartum. So that was kind of like baseline. That was always there and that stayed the same. But then about 9 months-ish, it was around 9 months postpartum, I had a crash. And I didn't know at the time what was going on.
So you didn't realize what it was?
No, I really didn't. But a lot of things changed at the same time. Like I had been losing weight kind of steadily and normally for me, and it stopped. And within a couple months, I gained at least 20, 25 pounds almost overnight. It felt like.
That's depressing in itself,
It
right?
is, yeah. But it was like there was this shift. And so the weird thing for me is I wasn't having classic symptoms of postpartum depression.
So what are classic symptoms in your mind?
What you think of when you think of depression, like low mood, inability to get out of bed in the morning, really tired, kind of just negative outlook on things.
Crying over anything?
Crying, just not feeling yourself, not being able to pull out of that.
What were you feeling?
Well, my energy levels were fine. I felt like myself. I felt sharp. I felt normal. My appetite was normal. But so for me, I started having weird mental things happen. And
Like, give me an example.
like what I learned later, someone labeled it, and I was like, that's exactly it. I wouldn't have known to say that, but it was intrusive thoughts. And some of them were suicidal. But the weird thing is they came and they weren't connected to my reality. It wasn't like I was so depressed, I felt like I couldn't carry on and I just wanted to end things. It was like,
Were they random, fleeting thoughts?
Yeah.
Dreams?
no, they weren't. They were random, but they were persistent. So it would be like I would be thinking about something and there would just be this thought of almost a visualization too.
So, like, I've had women tell me, I'm walking up the stairs with my baby and I find myself clutching my baby really tight because these thoughts are going through my head of my baby falling over the stair railing onto the floor.
Yeah.
Or I see my baby in the backyard alone and a tree falls on it. I mean, just random things.
Yeah, and mine were even more, they started to get even more bizarre. Like some things that were so bizarre I have not even ever told anybody because they were so weird. But
I won't make you share that today.
like, well, I mean, I don't even know if I remember all of them, but just really weird stuff like bugs crawling around, things crawling on my skin, seeing things like moving on the floor, like starting to hallucinate a little bit.
These are all hormone imbalances.
Yeah, and so, but
and chemical imbalances.
I even thought some of it was maybe spiritual, which actually is a really common theme that you tend to spiritualize things. But I just thought, you know what, what's going on? But again, I felt like myself, but I would be trying to have a conversation with somebody and I would just be having these super strange thoughts. Like,
would you call it like an anxiety almost over things?
I didn't feel anxious.
Like
that's the thing.
Was it a fear?
It became a fear because I thought I was losing my mind. I mean, I thought like, what if this keeps going and I lose control of myself? It really got scary because especially the suicidal thoughts, which I felt like weren't even coming from me. They were just going in my head and I couldn't stop them. But it got to the point where I didn't want to stay alone.
I'm gonna borrow your chair.
I didn't want to stay home alone with my kids. Because I didn't trust myself.
I've heard that before.
Even when I felt like I love my kids, I'm having a great time being, their parent, but
you didn't feel stable.
I felt unstable. I just felt like, what if I crack and no one's here and I do something really strange?
And if I remember right, your mom became involved and tried to help out with things at home.
Well, she did start coming down more because it was like, Johnny, my husband, had to go to work.
Right.
And so we started having people come over to stay with me
and
because I
was in contact with your mom through that time.
Oh, behind my back, huh?
Uh-oh.
Truth comes out.
Sorry, Mom.
Oh, goodness. Yeah, no, and I'm sure you were talking to Johnny at that time, and
I better be quiet. I'm gonna get in all kinds of trouble.
being a good, behind the scenes midwife. But a lot of people kept telling me, "You're depressed. You need to go get on medication," and I resisted that so much because I felt like that's not what's wrong. I don't feel depressed. I feel crazy. So it was, anyways, it just kind of snowballed and it got to this point where
did you feel like a failure because you thought you might need medication?
No, I just felt like that wasn't what was wrong.
Well, that's the first half of today's episode of More About Birth. After the break, stay tuned for more. Welcome back to More About Birth. After the break, we're going to pick up right where Angie left off.
It just kind of snowballed and it got to this point where
did you feel like a failure because you thought you might need medication?
No, I just felt like that wasn't what was wrong.
I remember having that conversation with you and you were just adamant.
I was adamant because I tend to not be a medication person, but I also just felt like that's not what was wrong. I felt like something was just mentally off and I wasn't sure what was going on, but it would be like trying to go through your normal day and something is constantly interrupting you, your mental thoughts. Like you're just trying to do something normal process. And there's like mice running on the floor around and it's like it's so distracting. I could almost outwardly I could have a normal conversation with someone and inside my brain is just buzzing and I can hardly follow the train of thought. And so after a couple months of this, it was mentally exhausting. But I think for me it was more if anything, it was more a fear of medication and like that it was maybe going to mess with me even more.
Or that you would depend on it.
Yeah. That I would become dependent on it, or maybe the side
you
effects.
Probably got angry with me because I was one of the people that said, hey, you're at the point where I think you need something to get over the hump.
No, you were persistent. I appreciated it. I just always felt like that's not what the deal was. I can still remember where I was in my house, in my bedroom, the morning that I just had a meltdown. And Johnny was getting ready to leave for work, and I just started sobbing, and I said, I can't do this anymore. I can't function. I can't worry about what's going to happen to me every second. And I had a meltdown, and he, he was like, okay. So we called our doctor that morning, our family doctor, and his wife was there when we called, and she knew that I was postpartum and all this. And she said, get him in, clear the schedule, get him in today. And that was amazing, and so we went in that day and did some blood work, and I talked to him, and it was nice just to talk to a healthcare professional and say, like, I'm having these thoughts that are uncontrollable, and some of them are really
You're almost
weird.
afraid to tell somebody because then you're like, they'll come take my kids away.
Yeah, they're going to hospitalize me or something,
They're going to call me a nut. Yeah.
And so, but it was really affirming that he just listened and was like, yep, I've heard it,
Yep.
And so that was good. And we did some blood work. And in my case, he called back, I don't know if it was a few days later, probably exactly how long it took, but he called me after hours and said, your thyroid is really low and your brain is crying out for more of this hormone to be made. And so in my case, it ended up being a thyroid issue mostly, and it ended up being a pretty simple fix.
Yeah. And you know what? It's interesting. After my fourth baby, my last one, a few years after that, I was still struggling with some depression postpartum. And I had my thyroid tested, and it was low.
Yeah. Yeah, and I'm telling you, it was...
That correlates quite often.
Yeah. It was wild. I mean, it was so wild, but it definitely did help.
How long did it take you to start feeling better?
A couple, 2-3 weeks. It takes a while. The thyroid hormone takes a while to get into your system and get working.
So what would you tell moms that are feeling like that? Because we're always so afraid to tell anybody because we're going to look like a kook.
Yeah.
They're going to take our kids away. Our husband's going to say, why did we have 4 kids?
Right, yeah. Well, and I was going to say, in my case, like I said, it was a relatively simple, straightforward fix. But I know at least 2 other people, and I've heard many stories since then of people that it wasn't as easy. And they did have to go, I know for sure 2 people, they had to go spend time in the psych ward of a hospital or somewhere.
Happens.
It does. And she was there for like a week and got on some more heavy duty medication, and she was able to pull out of it.
Well, see, like I said, sometimes if you can catch it soon enough, and it's not a thyroid issue or some other issue, if it's just severe postpartum depression, you can do a very, very low dose of something safe for nursing, just for even 8-12 weeks, and then you're good to go.
Yeah. But so, sometimes it can be a more straightforward fix, and sometimes, you do need to go to the hospital. You do need to get some more help, and that's fine. And I think for me, having gone through that situation and having walked through a really close friend with some similar stuff, there's no shame in it. Like, tell somebody, get some help.
But we feel shame.
We do. And it is not a good feeling to feel like you're not in control of your thoughts and you're going crazy.
Well, that or just being embarrassed that you have everything you could ask for, yet you still feel depressed. What's wrong with me? Why can't I be grateful and thankful? Why can't I be happy? My life, in all respects, is good.
Yeah, well, just like any other mood disorder or mental disorder, it is multifaceted. There are things you can do to make it better yourself, but a lot of times it's outside of your control. It's something that happened. It's a chemical imbalance. It's a hormone imbalance. There's lots of different things, and we're all broken, There's no shame in getting the help that you can get.
And I've found over the years, talking like to different MOPS groups or different ladies groups at church about my experience, that it gave other people the opportunity to come out about how they're feeling and what they've been going through and not feel shame about it.
Right.
So I have to admit, it was kind of humbling to say, I took an antidepressant. But it made all the difference.
Yeah. Yeah, and I like what you say about it can be a short-term option. Like I even think, because of what I've gone through in the past, I think now I would be way more open to, let's just do this preventatively.
Before it got out of control.
Yeah, before it gets crazy.
And some moms, I'll even put them on the Blues Busters herb because it's made specifically for pregnancy and breastfeeding. I'll put them on it before like that last month.
Yeah, yep.
Just to help them get over that hump. And it's pretty effective.
Yeah, yeah.
So I've been sitting back just kind of listening to you guys because I didn't want to interrupt. But so what's the accountability then for a mom? How do you have the support after the baby's born
I was just thinking
6 months
about that.
out so that you have someone there like you were there for Angie to communicate? Because I think if the mom's listening, she may not know, that she needs help and someone else alongside.
Or who to go to or how to go about it.
Yeah. Well, and like in my case also that it can hit at different times. I mean, it can hit more than a year postpartum and you're not looking for it.
Like sometimes your cycles don't come back for 9 months, 10 months, a year, even longer. And sometimes at that point, when you have that hormone shift, things just, they go all out of control.
Right.
Again, with a midwife, you have this personal relationship. So, it's someone you can go to even months down the road.
Right.
You don't have a midwife or you don't have someone that's cared for you in the medical profession that you can go to, I would let you call me. I would let you email me. I'll connect you with someone that can help you because this is a serious problem. And there are actually support groups. And one of the best things I ever did for myself after my third baby was to get involved in a MOPS group. MOPS is Mothers of Preschoolers. And I think at some point we'll have some MOPS leaders on here to talk to us more about what that looks like. But it's just a place for moms to go, and we would have a table that we set out with 7 other moms. We stayed with the same moms each meeting, which was twice a month. Got to know them as friends. I have a really good friend now that I met in MOPS 17 years ago. We're still friends. Our boys played together growing up, and those are the people that are going through the exact same things you are because MOPS is for moms, pregnancy through kindergarten. So they're all in that same phase of life, and that's an excellent place to go for help.
Plus with MOPS, they have support older moms that have had experience there as well.
There's mentor moms. Like at one point I was a mentor mom for a MOPS group, which just means I'm an older mom who's been there, done that, and I can be that person for them to call or be that person to say, hey, you'll make it through this, it's rough, but you can do it.
Yeah.
So postpartum depression would be considered pretty normal then? A lot of moms have it.
Well, baby blues is very normal. Almost all moms have a bit of baby blues to some degree. Postpartum depression, like I said, it's definitely more than 75% of people will have a bit of postpartum depression temporarily.
But it could be low thyroid. They should see their doctor.
You definitely, if it progresses past baby blues into postpartum depression, the first thing that I would do personally is find yourself a holistic doctor, naturopathic physician that's going to look at your whole picture. So going to look at your thyroid, your vitamin deficiencies, that kind of thing.
So basically a battery of blood work just to see what's going on physically.
Just get your overall picture of your overall health and see what's contributing to that.
Yeah.
And they would even be able to prescribe something if it was beyond natural help.
Right.
But don't let it go to the point where it's out of control, and don't ever feel shame.
Yeah.
So you guys have this relationship because you work together, and also you are her midwife. So what in these last few minutes here, what would you say to the audience that would help them understand maybe some of the solutions that are out there for them, maybe the relationships they should be looking to, like you guys have this relationship? What would be some final thoughts?
Well, if it's, before the fact, if you're at a place where you're still going to have more babies or you're pregnant right now, choose your care provider wisely. Is this person going to be available to you postpartum? How long are the visits? How well do you know them? How well do you trust them? Are they going to be available for you a year after the fact, even if you're not specifically under their care anymore? So
and get involved
think about those things.
In a mom's group during pregnancy. Establish that support system.
Well, that's been great conversation. It sounds like it could go on for a lot longer, but this is another great podcast, more about birth. We want to thank you so much for tuning in. And if you have questions or you'd like to email us, or maybe there's a topic you'd like to have us include, then email us at midwifeshannon@gmail.com. Thanks for tuning in to More About Birth, and we hope to see you here next time.